The faculty of the Department of Restorative Dentistry and Prosthodontics at the University of Texas School of Dentistry at Houston is pleased to present this audiovisual presentation on the fabrication of interim fixed partial dentures. This presentation is intended as a continuation of our previous presentation on the preparation of the 3-unit fixed partial denture. We hope that this video will be helpful to students and instructors for the fabrication of interim fixed partial dentures. In order to fabricate an interim fixed partial denture, the patient's existing condition must be recorded. A tray is fitted to the patient's mouth, coated with adhesive, and an alginate impression is made to record the area of the missing tooth as well as the other teeth in the arch. In this instance, tooth number 4 will be replaced with a fixed partial denture from number 3 to number 5. Let's start with the indirect method, in which the interim FPD is fabricated on a stone cast. After the impression is poured in dental stone, the form of the pontic is adapted to the cast. A second impression may be made of the waxed denture tooth pontic and poured in stone. The resulting cast is then used to fabricate a putty matrix. Alternatively, a putty matrix may be fabricated directly over the waxed-in pontic. Polyvinyl siloxane putty is mixed by kneading the base and catalyst until there are no longer any purple or white streaks. The putty is placed in a quadrant tray and placed over the site of the provisional restoration. It is important to ensure that the matrix extends at least 1 tooth anterior and 1 tooth posterior to the planned FPD provisional. It is wise to lock the material that was expressed through the holes in the tray around the external surface of the tray. This ensures that the putty material will not pull away from the tray during removal from the cast and while accomplishing subsequent procedures. After removal from the cast, the putty matrix is trimmed to within 5 to 8 millimeters of the cervical margins of the provisional FPD. This will permit easy manipulation of the acrylic resin. In order to ensure strong connector areas, the flash in the buccal and lingual embrasures of the soft material is trimmed with scissors. The cast of the prepared teeth is made ready to receive the methyl methacrylate material. To assist with removal of the interim restoration, the moist cast is painted with a suitable tin foil substitute such as All Coat or Magic Coat. A steady stream of air is applied to the gelatinous material to provide a thin layer of separating medium. Based on evidence in the dental literature, polymethyl methacrylate resin was chosen for this demonstration due to its high flexure strength. Because PMMA's setting shrinkage is greater than bisacryl resin, its fabrication is more technique sensitive. The polymethyl methacrylate, PMMA powder, is added to the methyl methacrylate liquid monomer. The ratio is approximately 1:1 powder to liquid by volume. The mixing time should be approximately 30 seconds. Initially, the material is quite runny, but after about 1 minute, it becomes sufficiently viscous to easily manipulate. The material is poured into the putty matrix in the region of the planned provisional FPD. This procedure is done slowly in order to minimize air entrapment in the acrylic resin. The material is cleared from the adjacent teeth. As you can imagine, any flash left over the adjacent teeth will result in a corresponding increase in occlusal vertical dimension of the restoration. Once the material has reached the doughy stage, the matrix and acrylic resin material is placed over the stone cast of the prepared teeth. Strong pressure is used to seat and hold the matrix in place. At this point, flash is easily removed from the cast and matrix. Before the material reaches its final set, the interim restoration may be removed from the cast. Soft flash may be cut away with scissors. This is particularly important on interproximal areas anterior and posterior to the provisional restoration, since excess material may prevent the resin from going exactly back to place. The matrix is positioned back into place. The material is allowed to fully polymerize. After setting is complete, only the matrix is removed and the interim FPD remains on the cast. Rubber tip pliers assist in removing the interim fixed partial denture from the working cast. Light pressure in a rotating fashion is used to remove the acrylic restoration from the cast. An acrylic burr and a slow-speed handpiece is used to trim the flash and contour the restoration. A metal disc is an excellent instrument to rough trim interproximal and gingival flash adjacent to the pontic. A sandpaper disc is used for fine trimming. The beginner may find it more comfortable to use the disc with the coarse side closest to the handle of the handpiece, employing the palm grasp. After trimming, the restoration is placed on the working cast and evaluated for fit. An explorer easily detects any marginal discrepancies. A fresh mix of resin is added to any deficient sections of the restoration. Petroleum jelly or a tin foil substitute, such as Magic Coat, is applied to the cast to prevent the new additions from adhering to the cast instead of the original acrylic resin. In order to prevent lifting of the restoration, the FPD is placed on the cast prior to the addition of new resin. The bead brush technique is an excellent method to use for final marginal correction. In this technique, the brush absorbs some liquid monomer and is then quickly placed in the polymer to pick up just enough powder to provide a flowable repair. After all the additions have been made, the cast, matrix, and restoration are placed in warm water to hasten the set and minimize porosity. The restoration remains submerged for approximately 5 minutes. The FPD is then removed from the cast using rubber-tipped pliers. Acrylic burrs and discs are used to trim the Interim FPD. A mixture of water and coarse pumice is a good medium for smoothing and polishing the restoration. A bristle brush in a slow-speed handpiece is used to smooth and polish. Care must be taken to ensure that the margins are not polished away during this procedure. Fine pumice is used to further smooth the acrylic resin. After corrections, the marginal seal is again checked for closure on the working cast. The modified ridge lap Pontic has a small, light tissue contact under the buckle surface. The lingual portion does not touch the soft tissue. The embrasures on the mesial and distal of the Pontic are opened for cleansability. High shine compound on a buffing wheel completes the polishing of the interim restoration. The final interim fixed partial denture is functional, aesthetic, and comfortable for the patient to wear during the fabrication of the permanent restoration. The direct technique also requires some preparatory procedures. Similar to the indirect technique, this method uses an alginate impression to produce a study cast in order to adapt the pontic. After the pontic is placed on the cast, a second impression is made to produce a cast with a full complement of teeth to fabricate an appropriate matrix. A vacuum form matrix is an excellent device to use for an interim FPD to be made by the direct method, that is, fabricated intraorally. Once the thermoplastic material is formed and trimmed to include one tooth anterior and one tooth posterior to the planned FPD, it is checked for fit on the preoperative cast with the pontic in place. The matrix is then checked in the mouth, or in this demonstration, the typodon. Be sure there is excellent adaptation to the two adjacent teeth. The teeth are lightly lubricated with petroleum jelly. A small brush is an excellent instrument to use to apply the jelly. Lubrication limits the flow of resin into the dentinal tubules and prevents adhesion of the resin to composite buildups. Clinically, it is normally not necessary to lubricate the gingiva and soft tissues, as these are generally sufficiently moist to prevent adhesion of the acrylic resin. The air syringe applies a steady stream of air to provide a thin layer of lubricant. The matrix should extend at least 1/2 tooth's width over the adjacent teeth. The acrylic resin is mixed in the same way that was used for the indirect interim restoration. A 1-to-1 ratio of powder to liquid can be altered to provide a slightly thicker consistency. While the material is still runny, it is placed into the vacuum-formed matrix. Ensure that the pontic and both retainer areas are fully filled with resin. Remove as much material as possible from the matrix occlusal surfaces, covering the adjacent teeth. Again, the reason for this is to minimize the amount of flash produced over teeth number 2 and 6. The acrylic is smooth prior to placement over the prepared teeth. Once the material is slightly doughy, the matrix is placed over the prepared teeth. Accessible flash is removed from the matrix. Firm pressure is applied over the matrix so that the matrix is fully seated over the teeth. After approximately 2 to 3 minutes, while the material is not completely set, the matrix is removed from the teeth. A fresh set of gloves prevents introducing unnecessary resin into the mouth. The matrix is gently removed from the teeth and carefully pumped up and down to eliminate any possible undercuts on the internal surface of the Interim FPD. The matrix may now be separated from the acrylic FPD. Slight finger pressure applied to the lingual and buccal surfaces assists in closing any margins that may have been opened through the previous pumping action. The Interim is removed from the mouth. While still soft, the material may be trimmed with scissors prior to the final set of the resin. Occlusal flash over the adjacent teeth is removed, along with gingival and interproximal excess. The restoration is again seated in the mouth, and light pressure is applied to the buccal and lingual surfaces of the retainers in order to seal the margins as close as possible. Additional refinements are made with scissors prior to the final set of the material. Clinically, the combination air-water syringe applies a spray which reduces the amount of heat applied to the teeth during the final acrylic polymerization. Once the restoration has completely polymerized, it is removed with rubber tip pliers. After removal from the mouth, the intaglio surface is inspected for voids. The restoration is trimmed and placed over the teeth for inspection. The Interim FPD should be free of voids and have good marginal seal, contour, and occlusion. An explorer can detect marginal discrepancy. If the explorer catches in an occlusal or upward movement, there is too much material and this should be shortened or trimmed. If the explorer catches in a gingival or downward movement, the margin is too short and material should be added. The modified ridge-lap pontic should be convex and provide adequate embrasure space for the distal of the anterior abutment and the mesial of the posterior abutment. The final Interim restoration should fit well, provide the proper pontic contour, and be smooth and comfortable for the patient. Thank you for viewing this presentation on the fabrication of indirect and direct Interim fixed partial dentures.